My name is Luke Lawton. I'm the Director of the Emergency Department. So when you come to the Emergency Department, you'll see our triage staff, and then you'll see one of our triage nurses who will make an assessment of relative urgency. We have to see the people who have the most life-threatening conditions first. After you've seen our triage nurse, we take patients into our special paediatric area. Then our senior doctors, trained paediatric nurses, will work out what's going on and see if we can fix the problem. I know myself, being a parent, my son did all sorts of stuff I'd never seen before. But if you're worried, don't discount that worry. Come and see us, and if all we have to do is reassure you that what your baby is doing is normal, that's fine. That's easy, and we're happy to do it. We also know that seeing your child sick or injured is very distressing for parents. We try very hard to keep parents informed at every stage. If parents are scared, worried, or have a concern, please make sure you articulate it. We're happy to answer questions. If you're coming up to the ED, 90% roughly of our patients go home within 4 hours. For kids, that can be a significant amount of time. It's always good, if you can, to think about sending the other kids to friends or family. It's also a good thought if your child has something particularly that you know keeps them occupied. Having that with you so that you can entertain your child while they're here is really important. And we can feed kids, and we do very happily. But if your child's a particularly fussy eater or there's a very special dietary requirement, having that with you is a reasonable thought as well. It's also very important that you give us as much information as possible. That includes things like their Red Book, which has a whole heap of really important data. Some children do have more complex medical histories than others, and that helps us make a better decision about your child. It can be quite hard to work out if your child is unwell or not. So if you hear nothing else from me today, it's this. If you are worried about your child, please bring them in. We would much rather see a child who is well and be able to say to you, hey, mum and dad, everything's okay, than have a child at home who is actually really sick with something serious, who suffers an adverse outcome because they delay their presentation.